this episode of Horse Shelter Heroes.
Our team, with all of our amazing assistants this morning, did a quick bandage change on Sapphire.
We are gonna take Galea out on her first ride around the property, just to see how she does in a more open area.
We have a very, very, very busy day today. We have a lot of animals being surrendered today, and we're gonna get lots of surgeries done.
They've been circling pretty good the last 2 days. Gives the horses something to spook at.
I'm Emily, and I'm here to adopt Quackers.
Fortunately, we were able to get a tractor trailer load of horses coming in.
I'm driving out of Walmart parking lot through the intersection, and I get T-boned it somewhere between 35 and 45 mile an hour.
You don't want to miss a single second of Horse Shelter Heroes.
We're busy.
You're busy?
We load and feed.
Ah.
This is Godiva, and Keith is currently giving her fresh hay and some water. She was returned. The girl that adopted her couldn't afford her boarding anymore, so she made the decision to have her brought back here.
I've been gone for the last 2 months. I am now living in Michigan and working from home from Michigan. I'm still doing everything, the Big Lick, the Full Circle of Life, the grants. I'm just doing it remotely. I come in 4 days a month. So this is my 4 day a month back to Tennessee, and I don't want to go home. I am currently working on the Full Circle of Life retreat that we are hosting the end of August. I am getting the registrations that are due today so we can figure out costs for all the rescues.
This is Sapphire, and we're going to be doing another bandage check today. Apparently, we heard from Hailey, who's on site here during 4th of July, that Sapphire got a little scared of the fireworks. So, hoping to check up on her and make sure that her bandages are all okay.
Listen, it's never the doctor that makes healing patients work. It's the support staff. Ask any nurse ever. How you guys look? This big flap of skin has adhered. This whole area right here that wasn't attached is now attached. It's gonna survive. I thought I was gonna have to cut that whole thing off, and I was mad at myself for leaving it, but it needed to be left. I have things that I'm really happy about and things that I don't love about this case. Our biggest concern when Sapphire came in was joint sepsis, and it is looking visually more positive that we don't have communication with joint spaces. Her neutrophil count went up slightly. So neutrophils are one of the white blood cells that indicate infection. We're running another CBC this morning to just track those trends. I'm really, really happy that we have very pronounced proliferative granulation tissue, which is just new baby skin cells, basically. However, what I don't love, and I'm not surprised about, is that if you look right here, this is the epithelium, so this is skin, and you can see the granulation tissue is already pooching above where the skin is on both sides. So the body needs that layer of healthy vascular tissue to cover the wound. But in order to actually heal this wound, we need the skin to grow over, and the skin can't get over the bump easily. So she's definitely gonna need at least one more surgical debridement. This flap of skin doesn't look like it's gonna survive and re-adhere, but that very large flap of skin that was probably 8 inches by 3 or 4 inches is re-adhering, and I think is gonna survive. So I'm really, really happy about that. I'm happy that we don't have signs of sepsis. We don't have progressing pain. And so far we have pretty good compliance. This mare is only 2 years old. So initially we had discussed her being 4 years old. Our intake day was kind of crazy, and our vet team didn't actually look closely at her teeth. We went by what the shipper had said about her. So based on her teeth, she is a 2-year-old. Someone's clearly worked with her a lot. She is sedated for her bandage changes because this is a lot for her. So overall, I think her chances of survival have significantly improved from that first day that we saw her, but she still has a really, really long road to recovery and at least one, but probably multiple other surgeries that she's gonna need before she can be adopted out.
Her neutrophils are back in the normal range. They're still high normal, which you wouldn't be surprised with, but we want them to trend down. But over last week, on the very last day, we switched her to Exceed because it had gotten above the high normal limit. So now it's still high normal, but it's back in the normal range.
That is this zinc oxide based medicated wound cream. Hey Mari, can you bring me the other? I just need the one next one. It is antimicrobial, antifungal, anti-inflammatory, perfect. Just be careful, you're in a compromised position right there. Awesome job, thank you so much. And then this is a Telfa non-stick pad. And this kind of roll gauze is really hard to keep very even tension, so we actually can do more harm than good sometimes with bandages. We have to be really, really careful not to create uneven pressure.
Look, now you're getting.
All right, I'm gonna stab her.
There you go, good girl.
She's gonna be man.
Oh,
But
no,
she was good
no,
for the
there you
photo.
go.
She
Too
just
mad.
was like, Our team with all of our amazing assistants this morning did a quick bandage change on Sapphire. We pulled her into our treatment room, sedated her just a little bit, pulled her bandages off, did some hydrotherapy, scrubbed both legs with chlorhexidine, which is like an antifungal, antimicrobial shampoo, rinsed them, redid a bandage change. Overall, systemically, I'm really happy with how she's doing. There definitely are some characteristics to her wounds that are very concerning for needing advanced ongoing care, but as far as her survival goes, things are looking much more positive than they were last time.
We are gonna take Galea out on her first ride around the property, just to see how she does in a more open area. And in case anything goes wrong, I have Crixus here to catch Galea if she does end up bucking and throwing Caleb. So we'll see how this goes. We just got done riding Crixus, which is the darker brown one here, and then Galea, which is our one-eared unicorn we have here. So both did pretty good. Galea, we just now started under saddle, so far she's making really good progress. And I just use Crixus as a pickup horse, just in case anything really went wrong with Galea. We have an extra horse here that we can use. But other than that, both horses did really good. Crixus is a little sore in his front 2 feet, so we'll probably get the vets to examine that really quick. But Galea also has a very bright future of becoming a really good riding horse, because so far she's been doing pretty good. So we'll see how long it takes to get her adopted.
So I'm really excited this morning. I just sent an email to Edge Life Technologies. Dr. Gina and I have done a ton of research. We've demoed some different ultrasounds to see what would be the best fit for Horse Plus. And this company that we are going with and have approval to move forward with a purchase on offers a very compact design that is wirelessly operated between itself. So instead of lugging around our big, heavy thing, we just have a small handheld device that communicates with an iPad. So it should be very functional for us to use in quarantine, in the field. So currently our ultrasound isn't very diagnostic to non-diagnostic for soft tissue injuries in horses, which is a huge problem that we have. But also pregnancy checking of horses with our current ultrasound has been very, very inaccurate because of the poor image quality and limited penetration depth. I'm tremendously excited about this new imaging modality. Our supporters have been incredible with raising the funds for this. It is a very expensive piece of equipment. When we're making life or death decisions on animals coming out of the slaughter pipeline, we use evidence to sleep at night. And sometimes the difference in a lameness can be very subtle and something that we can't palpate and can't see on an x-ray. So this new piece of diagnostic equipment is going to offer a significantly expanded capability for our Horse Plus vets to tell what's wrong with an animal and assign a prognosis and a treatment plans. And I'm thrilled. The company that we're going with is a very small company. They have amazing customer service. They did a demo with us. One of their incredible veterinarians has been a close friend and colleague for 10 years. She actually came to Tennessee with the ultrasound to my home and let me play around with it there. So I'm really grateful for this company. I think it's going to be an amazing fit for us and we can't wait to put it to use. If you enjoy watching veterinary medical and surgical procedures, such as castrations, eye enucleations, and abscess lancing, go to our YouTube channel, Horse Plus Vets. We have no censorship on that channel, so if you want to see all the details of us providing medical care to shelter animals, just go to YouTube and search Horse Plus Vets.
We have a very, very, very busy day today. We have a lot of animals being surrendered today, and our vets knew that they were going to be surrendered, so we're gonna get lots of surgeries done so there'll be no puppies or kittens in the future. And yeah, so very, very busy, and I'm working on details of a very large rescue mission myself and a lot of other things. So we're running everywhere. We have a great team here, and it just keeps growing, and that's fantastic.
So today we're doing a spay-neuter day with as many small animals as we can, mostly dogs today, but we're gonna try and get to some cats. So we're starting out with physical exams and blood work, and once they pass that preliminary, then we'll put them under anesthesia and spay-neuter.
Right now I'm just going through the horse list. I'm seeing who we have. We got some riding evaluations done yesterday on a couple of them, so I'm just writing down their levels and kind of seeing what needs to be done moving forward with some of these horses.
Wow, there's a lot of bodies in here.
Sorry.
No, it's okay. You know what? We really asked for help, and it's awesome that we have it.
I'm just sitting here.
Listen, you guys are not in the way. It's great. John, how are you this morning?
I'm doing good. How about you, Dr.
Great. I'm doing great. I love operating.
Yes, I see that.
We're very grateful to be finishing up with a lot of spays and neuters. We've gotten a lot done today, and we're looking to complete a lot more. And while we're finishing up, Corey is going to be heading up to quarantine to do some intake on some horses.
So we have a few things that we need to get taken care of up in quarantine. We have a couple fillies from the buyout before last that are still up there. They had some health concerns, so we're going to go up there today and pull blood for a blood test, a couple blood tests, just to see if we can figure out what's going on with them. And we're also bringing all the horses that we got from Colorado up there, and we're going to do their complete intake today.
What was that for?
This is rubbing alcohol just to help sterilize the area before I microchip her. So we just do that as a precaution. She's a youngin'. She's about 1.5 to 2 years old. She does have a temperature of 102.
Ooh.
I'm gonna go ahead and scan again. She doesn't have any snot or any swelling in lymph nodes. It's a pretty warm day out today too. So I'm gonna go ahead and just give her the things. She's not showing any symptoms of being sick, so I'll go ahead and do it all. Is 5-way. It covers just about everything that you can ask for with horse vaccinations. Covers encephalomitis, rhinopneumonitis, influenza, West Nile, and I believe it has the tetanus toxoid as well.
We got a helicopter circling around. We don't know if they're looking for poulters or if they're looking for somebody, but they've been circling pretty good the last 2 days. So gives the horses something to spook at.
So the horse in the chute, I just gave her everything that she needs besides strangles and dewormer. She does have a bit of a temperature right now, but she is pretty worked up. She's a little on the wild side, so I'm gonna give her a minute and see if that temp goes down. If it does go down, I'll go ahead and give her the strangles vaccine. So right now I'm just mixing strangles, letting it come back into the syringe, and I'm plunging it back in to help mix it all up. This is a live culture vaccine. That means there's live strangles virus inside of this.
So you're telling me if I get that, then I'm cured for strangles, pretty much?
Oh, you're probably already cured, John. You've probably been sprayed in the face before, just like I have. So we're done with the Colorado horses. It is about 11:30. We're gonna head down. We're gonna take lunch.
This is one of the little Arctic wasters, otherwise known as a mini split, that are scattered throughout the education center. And what it's doing right now is just blowing such cold air. It's set for 71 degrees. It's never going to shut off because the building's not enclosed yet. But it's producing a lot of cold air. And it's going around, it's keeping the workers cool. And if it was winter, we would change it to heat mode and it would produce a lot of hot air. So wonderful little inventions. They're super easy to install, and just super happy that we have 3 of them functioning now, actually 4, here in the education center. And it's really helping out with the building, and it's keeping the guys working harder, so that's important.
Why did the turkey go gobble gobble? Why did the turkey go gobble gobble, John?
Check the back.
Because it was very hungry.
Because it's gobbling up the food.
Oh, a dad joke I didn't get right away. Okay. Very funny. Cute.
I got the most.
Top secret information going on here. Hopefully you didn't hear anything, but John says you didn't hear anything. So I know he can edit it to make sure you didn't hear anything. But yeah, Dawn and I are working on secret stuff.
And everything I work on is always secret.
I know, right?
The grant department, and also the mentoring, which the mentoring is secret of what's happening right now. So yeah, good things.
Okay.
Good things are happening. But Dawn is also part of the mentoring process this year.
Ooh.
And I know that she's going to be taking a bunch of Sin-Chill to one organization. And Sin-Chill is a great product. It really helps horses relax and stay calm. And so we're sending some Sin-Chill up to one of the organizations that's from this year's mentoring. So
Oh.
yeah, I'll give you that.
Wow.
Bye, John.
Good job.
Go
Good job. Oh, okay.
Go away.
Okay.
We've seen enough.
Okay. Ow! Ow! Ow!
John.
Oh, I'm still recording.
How did you get it? Hey, did you get
Going.
We are officially done with our spay and neuter day. Altogether, we did 9 spays and neuters. I don't know the specifics on how many spays and how many neuters, but it was a lot. The vet team is tired, but we feel very grateful that we were able to help 9 animals get spayed and neutered so that they can go to living homes.
Today I have Crixus and Dixie in here. Crixus and Dixie are a little bit buddy sour to each other. Dixie more so than Crixus. But today we're going to be working a little bit on an exercise to help get rid of the buddy sourness. Just makes them a little bit easier, especially if you're going out in the pasture and one takes off, the other one wants to go with it. This could help eliminate that. All right, so that is it for working on that buddy sour issue. Now there are many ways to do it. This is just the way I found works the best for me. If you got horses that are buddy sour, hope you try this and hope it works for you. If not, I hope you do some more research and find some more exercises to help you out.
I'm Emily and I'm here to adopt Quackers. We have a 20-acre farm with multiple ducks and chickens and goats and a little mini donkey that he's gonna go home to, and he's got a big old pond he's gonna get to play in and some little kiddos he's gonna get to play with. So we plan on taking him today.
So we are about to head up to quarantine today. Fortunately, we were able to get a tractor trailer load of horses coming in. So we're gonna go up to quarantine, intake them, and make sure we get to take care of the criticals and the ones that we can medically manage, treat those, and then go from there.
Yeah, we got all of the horses in this group, horses and donkeys, unloaded. There are 21 of them. There's one little donkey that looks like he's got a pretty severe, he or she has a pretty severe forelimb lameness, and we're gonna try to get that one isolated as quickly as possible. Everybody's here safely. We're really happy they made it. They drove all the way from Texas, and we're gonna try to get through as many as we can today. This little donkey has a pretty severe right forelimb lameness. He's got an area of pretty acute heat and swelling right here. He is able to bear weight and move his shoulder through a range of motion, but we're gonna get some radiographs pretty quickly. This little donkey has a lot of heat and swelling over his right shoulder, and I was worried about a fracture of the scapula or the humerus. These aren't the world's best radiographs. Diagnostically, I didn't want to sedate him. He did get some pain medications, but he was really cooperative. I am concerned that we have a soft tissue component, but there's no evidence of a fracture. And because it's really, really warm and he's got some injuries on the shoulder, I think it may have happened recently, which means his prognosis is actually much better because we can give him medications and rest that he needs to try to heal that. So I'm gonna put him in a stall or a smaller paddock so we can get him medications daily. His heart rate was also 52, so definitely elevated, and he's definitely painful, but that's not in the realm of this animal has such severe uncontrolled pain that we need to make a decision right now. So I'm hopeful that maybe we can pull him through this. This mare is a Tennessee walking horse. So far, heart and lungs sound great. I haven't examined her mouth yet. She's got a pretty big scar on her left hind leg, and I'm not sure how old she is. This handsome gentleman is probably 35 years old and has a pretty foul odor coming from his mouth. So we're gonna take a closer look at his teeth, and I need to listen to his heart and lungs and GI sounds as well. This mare is only about 19 years old. She does have some nasal discharge, but she doesn't have any elevated lung sounds, and I didn't appreciate any other major medical concerns. So she's getting her vaccines and a microchip, and we're gonna get her turned out in her quarantine pasture. This gelding is about 20 years old. He has hypermotility in all 4 gastrointestinal quadrants, which means food is moving through his GI tract more quickly than it should. And he's got a lot of fecal staining under his tail and on his hind legs. So he's probably had chronic diarrhea. He's a quite low body condition score. He's probably about a 2 to 3 out of 9. He's being a very good boy. His mouth is definitely painful, so we're gonna do a sedated dental, but we're gonna take some dental radiographs today. We're also gonna run some blood work and see if we can find out a clue to why he's having chronic diarrhea. This little gelding has been a very good boy. He's very interested in treats. He's pretty dehydrated. He has a heart murmur today, but sometimes heart murmurs can be affected by dehydration. So we're gonna give him some electrolytes and some fluids, probably rectally, to try to correct that hydration imbalance. We'll probably run some blood work on him. His GI sounds are pretty normal. He's very reactive on palpation of his spine, but you can see he has a ton of scarring. He's also a very poor body condition. He does have a significant underbite, which is actually really cute. See how his lower and upper incisors don't quite match up, but I did a visual exam of his teeth and he looks like he's got pretty decent teeth. So that gives me hope that we can put some weight back on this guy, and he seems to be pretty comfortable. So we're gonna correct his dehydration, hopefully, and get him turned out. This super good boy got some rectal fluids, some electrolytes, some vaccines, and a microchip. He got Equispot put on to protect him from flies, and he's gonna get turned out into our 10-acre pasture. This gelding has pretty severe ring bone of his left front. He also has a pretty severe wave mouth, and he's got a low body condition score. He's about 9, I'm losing track of horses, I'm looking at too many. 19. We think he's about 19. He does show some discomfort on palpation of the affected area with the ring bone, but he's also a little reactive. So I'd like to turn him out, let him decompress. We're gonna pull him back in for a sedated dental, and we'll do a more thorough lameness assessment. Ring bone can look severe on a radiograph and not be severe clinically, and vice versa. It can be very severe clinically and look like not a big deal on a radiograph. So I don't want to make a decision on this horse based on that x-ray, and today's not a great day to evaluate his response to pain on palpation for this particular problem. So he's about to get turned out. I'm putting Equispot on him now so the flies don't bug him, and we will pull him back in the next week or two to take a closer look. Unfortunately, we've seen a slew of cases over the years at Horse Plus of donkeys arriving, some of them looking healthy, that go into pretty acute respiratory distress within hours. Those cases have rapidly progressed to death within about 24 to 48 hours, regardless of intervention. So we've tried high-dose antibiotics, we've tried high-dose steroids, we've tried any number of different anti-inflammatories, IV fluids, things like that. And what we found on necropsy in these cases is severe, basically cardiopulmonary collapse, where the lungs are filled with like a pink foamy fluid, and in a lot of cases, parts of the lungs have become necrotic. We've cultured various bacteria from the lungs. I've always wondered if maybe lungworm plays a role, but I've never actually seen a lungworm in a donkey case. And unfortunately, a lot of the bacteria that we're getting from these cultures are kind of commensal bacteria. So we don't know what it is that takes bacteria that lives in these donkeys' environments and causes severe disease. We know that it's related to stress. We know that it's related to transport in some cases. And I would love professionally to come up with a definitive answer as to what this is. We kind of call it like the donkey lung disease. But you can see this donkey is showing what we would typically see early on, where his respiratory rate is severely elevated. It's probably 5 or 6 times. And if you listen to the lungs, they sound squeaky and rubbery, like there's like those airways are kind of sticking to each other and he's really struggling. I am not an asthmatic, but the feeling of not being able to open up your lungs, I can imagine would be kind of like asthma. You're kind of drowning and unable to catch your breath. And we really don't want these guys to suffer. So I'm recommending the last act of kindness. And I am actually really worried. We had 8 donkeys in this load and everybody was exposed to each other. So we're gonna separate these guys out and pray that we don't have any more cases pop up.
It's really, really hard. In California, we never saw this disease in donkeys. We'd rescue donkeys from auctions all over the place, never encountered it. The first group of donkeys we rescued from an auction, they came down with this. Ever since I've been in Tennessee, this has been an issue. And I don't know if it's because there's so many auctions that are just not clean and it's just disease spreading. But it was something in California that we never encountered. But it is rampant back here and it's devastating. I love donkeys, but this disease is something that needs to be stomped out because it is killing so many donkeys that could go on to find wonderful homes. We're wrapping up for the day. The horses that are nice and friendly, they get to enjoy this beautiful 10-acre quarantine pasture. So I'm about to let them out and it's my favorite part to see them just running out and just being so happy and being horses like they should be. So I'm gonna open it up and, all right guys, you ready? They are out and enjoying their time. Some stayed close, some are like, we're out of here. There's a pond back there. It's pretty nice for them. So yeah, we try to say yes as often as we possibly can, but we can only say yes through support. So please do donate. Donations are needed to keep all of this going.
So we are done with today up in quarantine. We got through 14 of the horses that came in. We're gonna have to come back tomorrow and finish everybody else up. But we got through all the donkeys and a few of the horses. And a lot of the horses got to go out into the 10-acre, which was so fun to see. Hopefully a lot of them can find their forever homes.
At Horse Plus Humane Society, our goal and mission is to save as many horses as possible out of the slaughter pipeline. Through our buyout program, we are intercepting horses before they even get to the auction. Our goal is to rescue as many horses as we can, bringing them to our organization and letting our expert veterinarians evaluate them to determine what each horse needs as an individual. We help as many as we can, even if they need the last act of kindness, because we believe that every horse is deserving of kindness and medical care and treatment. When horses come here to Horse Plus Humane Society, we're able to tell their stories and transform their lives. But none of it would be possible without support from people just like yourself. So please make a donation right now. The horses are counting on us, and we are counting on you.
I went to town early this morning to get supplies for the education center, a little bit more insulation and some screw bits, and the goal today was to get as much drywall done as possible because the electric inspector came by yesterday and said we're good to go. I'm driving out of Walmart parking lot through the intersection and I get T-boned at somewhere between 35 and 45 mile an hour by a Ram truck. And this happened to my truck And it makes me sad because number one, I could have been seriously injured. And number two, my truck, which was in pristine condition, likely totaled. Door isn't gonna work, bed's ruined. And I mean, on the bright side, I get to go truck shopping. On the dim side, that always costs more money to get from insurance. But I'm glad everybody's okay. Her vitals were fine. She's probably going to the hospital just to get checked out. If I don't feel good tomorrow, I'm going to the hospital to get checked out, because number one, her insurance is going to have to pay for it. Number two, I'd rather be checked out and be fine than not checked out and not fine. So we'll see how I feel tomorrow when the adrenaline comes down. But you know, right now it's like, might have to find somebody that works at GM to get a friends and family discount.
I am getting all the x-ray equipment set up to take back rads on Godiva. The first time she was here, we took rads and noticed some spinal changes. I'm just gonna repeat radiographs today on her back to see if her back has gotten worse or if it is staying about the same, to determine the length of time, well, the vets will determine the length of time that she will be able to be ridden. I am not a veterinarian, but I've seen quite a few x-rays. I do believe that these x-rays are diagnostic. Just from what I can see with my naked, untrained eye, she has a lot of remodeling in a lot of different places. She is an older lady, and we knew from the first time she came that she had the starts of some of her spines kind of getting a little bit close. I can see remodeling and their spines actually touching now. So I'm no vet, but I do think it hurts for her to be ridden. We'll just have to see what the vets say.
Well, we just opened packages on our live, and an amazing fan from Australia sent us these Tim Tams. And some of our staff didn't know what they were, and they were like, what are these? And now they are also Tim Tam fans. So thank you so much.
I'm getting ready to go and get Ruger. I'm gonna load him up in Dawn's car so that she can take him to his new home in Michigan. So Ruger is off to his forever home, and we are so happy for him.